Hi, I'm Dr. Gail. I've been a gynecologist for over 20 years, and for 15 of those years, I've been a consultant. I went into gynecology to help women and to advocate for them, and it's the second role that I am performing today. I'd like to talk about hysteroscopy. Now, hysteroscopy is an indispensable investigation and treatment option in gynecology. Tens of thousands of women undergo hysteroscopy every year in the UK, and hundreds of thousands or millions worldwide. Hysteroscopy keeps cropping up in the media and has even cropped up in Parliament because of those tens of thousands of women who undergo hysteroscopy in the UK. A significant proportion have unacceptable pain. I've been following this issue for several years now. And a few years ago, I took the decision that every woman I see who requires a hysteroscopy, I would offer every available form of pain relief to her. So every patient I see is offered either to have hysteroscopy as an outpatient or to have hysteroscopy in an operating theatre. Many of these women have been quite vocal, and understandably so. They say that they are ill-informed. They don't understand what's going to happen in the procedure, and the pain that can result from hysteroscopy is often downplayed. We know that up to 1 in 3 women who have an outpatient hysteroscopy endure severe pain. This is unacceptable. In my view, women should be educated about hysteroscopy, and I've attempted to do that by producing not one but 2 videos about hysteroscopy. I've produced a video that explains the procedure in detail, explains the risks, and offers the options of outpatient or inpatient hysteroscopy to every patient. In my practice, every patient that comes to my clinic views that video beforehand, either by a link or in the clinic before they enter the room. They're played that video. So when they come into the room, they understand exactly what the procedure entails, they understand exactly what the risks are, and most importantly, they understand that they have a choice of how and where they want the procedure to be performed. So I've done this to educate patients, but maybe the time has come to also educate colleagues and other clinicians who perform this procedure. When I was a medical student, a professor said, "Listen to the patient. She's teaching you medicine." Well, I say now, it's time to listen to these women because they are teaching us how to be good doctors. And truly, I have modified my practice because of the experiences that women have shared online and with me personally as regards hysteroscopy. So, in my view, the best practice is that patients are informed beforehand what's going to happen, because some women say they come and they have no idea they're going to have a hysteroscopy until it's happening. Patients should all be given a choice, and yes, we all know that patients are given choice as to if they want a hysteroscopy, but they should also be given the choice of how and where they want the hysteroscopy. And although we know that 2 out of 3 women are okay with the procedure, tolerated well, but we shouldn't cater for the 2 out of 3. We shouldn't cater for the majority that are fine with it, we should cater for everybody, and that includes the minority. And as an analogy, take hysteroscopy itself as an example. We do hysteroscopies on women often to rule out sinister lesions or cancer or precancer of the uterus. It's not because we expect them to have it. It's because we want to make sure we don't miss it. So I want to make sure that those women who will struggle with this procedure, who will have PTSD in years to come, who will keep rallying for other women online, I want to make sure that those women are not missed in the first instance. Because obviously I live in a world of gynecology, but I'm not aware of any other procedure that is always in the news, is always on social media. Women contact their physicians or consultants to say that it was horrendous. So why this procedure? I think we should have moved past that now. And I think women should be educated and informed. And yes, as was told to me recently by a patient, well, by a woman online, it's not just about educating the patients, and it's not just about giving women the tools to advocate for themselves. Because when a patient goes into a hospital, they often defer to us as doctors, as clinicians. So it's up to us to make the choice easy for them. It's up to us to educate them. Because it does take some gumption to kind of have to demand something in an appointment or feel you need to. And I think that can make the whole experience more difficult for patient, for the doctor or clinician as well. So these are my views. As I say, every patient has the option, and that it has revolutionized, I guess, my practice in terms of the women, but actually it hasn't really changed the proportion of women who end up having a general anesthetic. Most will still go on to have an outpatient hysteroscopy, but those that need a general anesthetic or feel they need a general anesthetic, they absolutely have that option. And they don't need to justify why. Patients say we're the experts. Yeah, we're the experts in gynecology, but the women are the experts in their own bodies and their own wishes, and that's their right. In addition to offering outpatient with oral medication, heat packs, and intanoxogasinate to every patient, as well as the general anesthetic, those two choices, my ultimate goal is to include, as part of that choice, hysteroscopy under sedation. I've not yet accomplished that, but I'm working towards it. And hopefully in the future, I will be able to offer that to women as well. And hopefully, again, every woman will have that choice. Because I think unless and until that happens, then this issue will keep cropping up. And there comes a time when we must stand up and try to change a system in which we work because it's the right thing to do. And I am convinced that this is the right thing to do for women. Thank you for listening, and I'd be grateful if you could share this video far and wide, because all great change has to start somewhere. And the more this message is amplified, hopefully the closer and closer we will get to seeing and putting an end to this issue. Thank you.